Welcome you all. I'm Dr. Arun, working as assistant professor in Emmanuel Arthur College of Pharmacy. Today's video class is about hypertension, and today's session we'll see about the definition of hypertension, the etiology of hypertension, the pathophysiology of hypertension, and the clinical manifestation, the diagnosis, the risk factor, and complication. So coming to definition, is defined as a persistently elevated systolic blood pressure values of 130 mmHg or more, or diastolic blood pressure of more than 80 mmHg. Blood pressure is the force exerted by the blood against the walls of the blood vessels. The pressure depends on the work being done by the heart and resistance of blood vessels. And the normal blood pressure will be about 120 per 80 mmHg. And the values we have classified as normal, pre-hypertension, stage 1 hypertension, and stage 2. In normal, the systolic will be less than 120 and the diastolic will be less than 80. In pre-hypertension, the systolic will be 120 to 139 and the diastolic will be about 80 to 89. And for stage 1 hypertension, the systolic will be of about 140 to 159 and the diastolic will be about 90 to 99. The last one is stage 2. The systolic will be greater than or equal to 160 and the diastolic will be greater than or equal to 100. The types of hypertension are essential and secondary hypertension. Primary hypertension is the most common type, accounting for about 90 to 95% of cases. There's no single identifiable cause and developed due to combination of genetic and environmental factors. And the risk factors included in primary hypertension includes increased salt intake, obesity, stress, sedentary lifestyle, alcohol consumption, and increasing age. The pressure rises gradually, and patients are usually asymptomatic for many years. And secondary hypertension is due to a known underlying cause and accounts for about 5 to 10 percentage of cases. It may be caused by kidney disease such as CKD or renal artery stenosis and endocrine disorders like hyperaldosteronism, Cushing syndrome, pheochromocytoma, and thyroid disorders. And certain drugs can also increase the blood pressures, such as oral contraceptives, steroids, NSAIDs, and or pregnancy-related conditions. And the etiology, the causes, the first one is smoking, then obesity, then high salt intake, chronic stress, and chronic kidney disease, too much alcohol consumption, and family history of hypertension, adrenal and thyroid disorders, and abnormalities in RAS system. And coming to pathophysiology, how the hypertension occurs. Basically, in hypertension, the pathophysiology, there are lot of pathophysiology which can lead to an hypertension. In this slide, we have seen how the blood pressure is increased by the RAS system. There are a lot of pathophysiology like sympathetic nervous system overactivity and renin-angiotensin aldosterone system, renal sodium and water retention and endothelial dysfunction and vascular remodeling and hormonal cause and obesity and insulin resistance and genetic factors. And this slide we will see the hypertension, uh, the pathophysiology of the RAS system. So, how does RAS system leads to an hypertension? Coming to the point. For example, when a sympathetic nervous system activation or a decreased blood volume in the renal system. When I'll try to explain decreased blood volume in the juxtaglomerular cells. So when the blood volume is decreased in the juxtaglomerular cells try to increase the blood pressure. So it releases juxtaglomerular cells releases renin in the bloodstream. So renin is basically an it can be called as an hormone or an enzyme protein. So when renin is released to the blood, the angiotensinogen, which is already present in the blood, which is synthesized by the liver, it gets cleaved by the renin. So basically, we can tell renin converts angiotensinogen to angiotensin 1. So angiotensin 1 is basically an inactive form. So it has to be converted to angiotensin 2 for its active things. So angiotensin 1 is converted to angiotensin 2 by an enzyme called angiotensin converting enzyme. That is basically called as ACE, which is basically produced by the lungs. So when angiotensin 2 is converted, angiotensin 2 is converted, it causes vasoconstriction and it causes release of aldosterone release, and also it stimulates ADH hormones. So basically, when vasoconstriction occurs, the blood pressure rises. So when aldosterone released by the adrenal gland, sodium and water retention occurs. When sodium and water retention occurs, the blood volume basically increases. When blood volume is increased, the blood pressure is also increased, and which causes hypertension. And this will be the pathophysiology, the pathophysiology which is described by the raw system. And the clinical manifestation are severe headache, chest pain, blood division, bleeding from nose, difficulty in breathing, irregular heartbeat, nausea and vomiting, pain in neck and back, flushing and dizziness. And the diagnosis: BB is measured with sphygmomanometer initially in both arms. Correct technique: patient last correct cuff size, arm and heart level, and diagnosis: repeated BP readings on different occasions. Uh, 24 hours ambulatory BP helps detect white coat hypertension, and ECG, renal function test, and urinary analysis assess organ damage. And the risk factors are excessive body weight, chronic mental stress, a smoking habit, excessive alcohol intake, inadequate exercise, excessive sodium intake. And the complications are myocardial infarction, stroke, hypertensive encephalopathy, dissective aortic aneurysm, hypertensive nephrosclerosis, peripheral vascular disease. Thank you all. Hope you understand the topic of hypertension, which we have seen today's video classes of about the definition, etiology, pathophysiology, clinical manifestation, diagnosis, risk factors, complication. Hope you all understood the the video class today. Thank you all for watching this video. Thank you.